Hello, my name is Kevin Choi. My project title is How Does the Racial Background of Patients Impact Their Experience Living with Cancer? I'm expected to graduate this upcoming spring 2022. My senior honors project mentor is Dr. Alice Lee, who is faculty member in the Public Health Department. Just a little information of who I am and how I got to my honors project. Throughout my years at Cal State Fullerton, I've worked in multiple clinical settings with specialties ranging from pain management, family medicine, hematology, and oncology. My goal is to become a physician assistant, hopefully in an oncology office, because I want to work with cancer patients, given how common cancer is in the United States. Since my study focuses on patients' experience with cancer, I hope through this honors project, I can better understand the impact cancer has on patients' lives and ultimately improve the quality of patient care. Now, a quick background to my research. According to CDC, there are more than 1.6 million newly diagnosed cancer cases and 600,000 cancer deaths each year in the United States. And the reason these numbers are so high is because there's much we don't know about what causes cancer, and there's really no cure for cancer. This is why healthcare professionals focus on treatment and disease management. Therefore, it is crucial to provide quality care to cancer patients. Studying the impact of race is important because the racial disparities existing in the healthcare field may lower the quality of care and patient care experience for a certain race. How race might impact patients' experience living with cancer has been studied before. For example, one study in England using data from the National Cancer Patient Experience Survey found that ethnic minorities such as Blacks and Asians reported lower satisfaction and an overall less positive experience with the care they received in comparison to white. Another study using the same data source also found that ethnic minorities were less likely to have a positive experience when it came to information provision and effective communication from providers. Within the United States, a study using data from surveillance epidemiology and end results Medicare Health Outcome Survey found that cancer patients who are Black had lower mental score compared to non-Hispanic whites, and Hispanics had overall poor health-related quality of life when compared to non-Hispanic whites. Clearly, race plays an important role when it comes to cancer well-being, which is why I want to study this topic using another data source. Therefore, the goal of my project was to examine how cancer patients' racial background might impact their perceived quality of life, as well as their mental, emotional, and physical health. To accomplish this, we use self-reported data from the Medical Expenditure Panel Survey, also known as MEPS, which has been conducted by Agency for Healthcare Research and Quality since 1996. The goal of MEPS is to collect information on health services utilized by people in the United States, including how often they are used, as well as the costs associated with them. A supplemental questionnaire that's part of MEPS is the Cancer Self-Administered Questionnaire, also known as CSAQ, which has been only administered in 2011, 2016, and 2017. It is a survey that focuses specifically on current cancer patients and cancer survivors and includes questions relating to the cancer experience, including burden of cancer, medical care for cancer, long-lasting effect of disease, as well as financial impact and employment outcomes. For my project, I focused on questions had to do with how cancer has impacted patients' lives, particularly when it comes to their quality of life, as well as their mental, physical, and emotional health. This is the actual survey that was given to the participants who had cancer history. This question asked if they worry that cancer may come back or get worse. These ask if there have been any positive changes due to being diagnosed with cancer, such as if cancer experience made them a stronger person, can cope better with challenges in life, if the experience made wasn't a reason to make positive changes, and if they started making healthier habits. And these last few questions ask patients to rate their physical health, quality of life, mental health, and their emotional health during the past 7 days. We focused on the cancer patients who participated in 2016 and 2017 CSAC surveys. We excluded patients diagnosed with only non-melanoma skin cancer and or skin cancer with a known kind, since these cancers are like to be less life-threatening. We also excluded those who were not covered by some sort of insurance, trying to remove the impact of financial burden on the quality of life. Lastly, we only included subjects who answered all 9 questions that we were interested in for the study. This resulted in final sample size 1,161 cancer patients. The majority was non-Hispanic whites, followed by Black, the Hispanic white, lastly Asian. Due to the small number of certain races, especially Asians, we grouped similar responses together. For example, for Likert scale surveys, questions that asked patients to rate their health from poor to excellent. Excellent was grouped with very good, and fair was paired with poor. We conducted chi-square analysis to determine whether there were statistically significant differences in cancer patients experienced by race. All of our analysis was done using a complex survey weighted analysis approach in SPSS, a statistical survey to ensure our results are representative of the US cancer population. This table shows a quick snapshot of the demographic characteristics of our subjects. The mean age was 65.32 years. About 40% were male and 60% were female, and about 75% had at least a high school degree. In addition, the vast majority of our study population was born in the United States. The table 2 represents our analysis for mental, physical, and emotional health rating by race. The first question asked them to rate their mental health. Second asked if there were any emotional problems within past 7 days. And the third asked them to rate their physical health. We found that there was a statistically significant difference in distribution of physical and mental health rating across the races. Specifically, it appears that about 50% of non-Hispanic whites and Asians reported excellent or very good ratings, whereas only 42% of Hispanic white and only 33% of Blacks reported such rating. Table 3 shows our results for whether or not having cancer had a positive impact on patients by race. The question included whether the cancer patient experience made them a stronger person. Were they able to cope better with challenges? Was this a reason for them to make positive changes? And if they were making healthier habits? We found that there was a statistically significant difference in all of the positive attributes by race. As you can see, higher percentage of Hispanic white and Blacks reported yes to all of the beneficial changes. For example, approximately 80% of Hispanic white and Blacks believed that cancer experience made them stronger, but only 60% of non-Hispanic whites and Asians believed it made them stronger person. Lastly, table 4 depicts the analysis for the questions related to whether they were worried if the cancer was going to come back and their quality of life rating by race. The results indicated that all races were equally worried about their cancer coming back. However, there was a significant difference in quality of life by race. Here we can see that only 43% of Hispanic white and Blacks reported excellent / very good rating for quality of life, while 65% of non-Hispanic white and 58% of Asians reported these ratings. So overall, we found that there were statistically significant differences in cancer's impacts across races. Hispanic whites and Blacks were most likely to see their cancer in a positive light, which helped them make positive changes. But at the same time, Hispanic whites and Blacks reported lower score on when they were asked to rate their physical health, quality of life, and mental health when compared to non-Hispanic white and Asians. One reason for why cancer may seem to have more positive impact among Hispanic white and Blacks may have to do with cultural and religious differences. For example, certain cultures and religions may emphasize the importance of overcoming hardships and learning from their experience. A study from 2020 found that increasing religious attendance was associated with decreased depressive symptoms as well as having positive well-being. However, despite cancer having these positive changes, Hispanic whites and Blacks still responded lower quality of life and poor physical and mental health. And this may be related to socioeconomic differences. We know cancer can take a significant financial toll on patients, and there are major wealth disparities across race. For example, according to the Federal Reserve, the typical white family has 8 times the wealth of the typical Black family and 5 times the wealth of the typical Hispanic family. This indicates that there's a significant wealth gap across races, and dealing with these financial difficulties could have a major impact on overall health. Some of the limitations that we wanted to point out was that CSAT consisted of self-reported data. We also did not consider patient's type of cancer or how long the patient has had their cancer, and this could play a role on quality of life since some may actively going through treatment while others have survived their cancer many years ago. Lastly, we also had limited information on our patients. For example, we did not consider their financial situation, the familiar and social support that was available to them, the quality of medical care they received, as well as their medical history in terms of previous health conditions or other comorbidities. However, with that said, our project identifies important racial disparities when it comes to cancer patients' experience, their perceived quality of care. I think that it is important to be aware of these disparities as a future health professional so that the appropriate support is provided and patients' needs are met. Thank you.